A patient had a amitriptyline poisoning and ECG is showing a QRS duration of 135 milliseconds. Non-sustained VT is there. So how do you manage amitriptyline poisoning is the important question. Yes. What is your answer, doctor? Amitriptyline poisoning. What is the most important treatment that you need to initiate? Excellent. Vikas rightly says it is soda bicarbonate is the most important thing. So what is the effect of amitriptyline poisoning? It will lead to sinus tachycardia because amitriptyline is a tricyclic antidepressant which has an anticholinergic effect. Cholinergic stimulation will lead to bradycardia. Anticholinergic will lead to tachycardia. So you have a tachycardia. Then QRS is prolonged and there is a wide terminal R wave in the lead AVR. R wave is a positive wave. You don't expect a positive wave in AVR. All waves are negative waves in AVR. So that is what you need to remember. So 21-year-old, sorry, he has hemisection of spinal cord at T10 level. Below the level of this lesion, Brown-Sequard syndrome, 2 months after the injury, what are you expecting? Shoot your answer, doctor. In this case of the Brown-Sequard injury, below the level of the lesion, what do you suspect? All of you know, pyramidal tract lesions will be ipsilateral. Very good. Dipali, Sharma, everybody like to say contralateral loss of pain and temperature. Absolutely right. Absolutely. A 32-year-old man is being treated with the chemotherapy for testicular cancer and that brought a remission. What is the underlying mechanism by which a chemotherapeutic agent can be able to cure the cancer? Is it the necrosis? Is it the apoptosis? Is it mutagenesis? Yes. What is your answer, doctor? Excellent. As Vikas says, it is the apoptosis that brings the response is what need to be remembered. A 79-year-old, 2 centimeters splenomegaly, small axillary lymph nodes, and you also see hemoglobin low, and what is the most likely diagnosis? And her WBC count is almost 34,500. So in this given scenario where she has got a 2 centimeters splenomegaly, discrete axillary lymph nodes, what is the most likely diagnosis in this given case is my question to all of you. Yes, please punch your answer. Given the options, yeah. What is the most likely cause? Excellent. CLL, chronic lymphocytic leukemia. Always remember, ALL is a pediatric tumor. CML is typically a middle-aged man with a significant splenomegaly. Then AML can be with the bleeding gums and all that. Once more a middle-aged or any age. But CLL typically is seen in very, very elderly people who are completely asymptomatic, but for a little axillary lymph node, a little slightly enlarged spleen, and you have done a complete blood picture. What is this cell? What is this cell that you are seeing in this case of CLL called as? What is the name of that cell, doctor? Come on. Punch your answer. Excellent. Ritu Raj rightly says smudge cell. Whenever you are preparing a peripheral smear, that CLL's lymphocytes are easily broken down, which is called smudge cell, is what you need to remember. 74-year-old Distressing restlessness of the leg. Now the question is straight to you. Restless leg syndrome. What is your treatment, doctor? Restless leg syndrome. I want to know from all of you. Very good. Isha Garg rightly says ropinerol is the one. Vikas is clean ball. It is not propranolol. Yes. Indumukhi, clean ball. It is not propranolol. Don't think restlessness is equal to tremor. I know why you kept propranolol, right? Yeah, ropinerol is used for the treatment of restless leg syndrome. 34-year-old with 6-year history of Sjogren syndrome is found that she was 14 weeks pregnant. Which autoantibody can cause congenital heart block? Easy question. Yes. Everyone is saying anti-Rho antibody. Absolutely right. One question on one of the serological parameters of the autoimmune entities is an invariable question in the exam. 40-year-old with asthma, and she used the salbutamol 3 times a day. She woke up at the night wheezing once or twice a week. In this given case, though using salbutamol, nocturnally she is having bronchospasm. What is the best asthmatic drug that you want to use, which is called LABA, long-acting beta-2 agonistic drug? Very good. Kunjit Joshi, no, Kunjit is absolutely wrong. Excellent. Kriyatandava, yeah. So, salmeterol is the one which is called LABA. So, don't forget asthma drugs, doctor. One question about their side effects, mechanism, first line. In COPD, what is the first line drug to manage the wheezes? In COPD, what is the first line drug to manage the wheezes? Can you please punch your answer? In case of COPD patient, what is the excellent? Kunjit, Indumukhi, everyone is saying ipratropium is the bronchodilator of choice to manage the bronchospasm in case of the COPD patients. So, salbutamol, terbutaline are typically short acting. Acute attack of asthma, they are the treatment of choice. They are taken inhalationally also, and they act on adenylate cyclase and increase cyclic AMP. Salmeterol, formoterol are long acting, so can be given for prophylaxis of nocturnal asthma. And ipratropium mainly for COPD, and it blocks M receptors. And theophylline, aminophylline, if you take, theophylline is deriphyllin orally and aminophylline parenterally, they inhibit the phosphodiesterase and increase the cyclic AMP. This is what you have to emphatically remember for the exam. Not only exam, whether you join MD pathology or whether you join MD pediatrics, if you don't know how to treat the bronchial asthma, or if you don't know how to treat diabetes, hypertension, malaria, urinary tract infection in this country or any country, it is worthless to have a medical degree. That's the reason sometimes we should also read, there are at least some 30-40 topics which you should at least have better knowledge than your patients, right? Now, 21-year-old woman, sorry, last 1 week, continuously I am talking. I talk here as a teacher, I talk outside as a physician. So ultimately, the vocal cords are not cooperating today. I am not at the best. Don't mind.